Hello and welcome. Today we're diving into the world of neurology to understand a condition called hydrocephalus. It's a term that might sound complex, but we'll break it down and explore what it is, how it affects individuals, and what can be done about it. So, what causes hydrocephalus? The underlying cause is an imbalance between the production and absorption of cerebrospinal fluid, or CSF. CSF cushions the brain and spinal cord, removes waste products, and helps regulate pressure within the skull. This imbalance can arise from a variety of factors, including congenital abnormalities present at birth, such as neural tube defects. It can also be caused by acquired conditions later in life like brain tumors that obstruct CSF flow, bleeding in the brain, infections such as meningitis, or traumatic brain injuries. Now let's understand the pathophysiology. Think of the brain and spinal cord as being surrounded by a fluid-filled space. This space is normally maintained with a delicate balance of CSF production and absorption. When there's a blockage in the pathways CSF travels through, or if the body can't absorb CSF properly, the fluid builds up. This increased fluid puts pressure on the brain tissue, which can damage the brain. This damage can lead to various neurological problems, depending on the severity and location of the pressure. Let's talk about who is affected. Hydrocephalus isn't discriminatory. It can affect anyone from infants to the elderly. Congenital hydrocephalus is, as you might guess, present at birth or develops shortly after. Acquired hydrocephalus, on the other hand, can develop at any age due to the reasons we just discussed. While precise global prevalence numbers are challenging to obtain, congenital hydrocephalus is estimated to affect roughly 1 to 3 out of every 1,000 births. Acquired hydrocephalus incidence varies depending on the underlying cause. The signs and symptoms of hydrocephalus vary greatly depending on age and the severity of the condition. In infants, you might observe an unusually large head size, a bulging or tense soft spot on the head, excessive sleepiness, irritability, poor feeding, vomiting, and seizures. Older children and adults may experience headaches, nausea, vomiting, blurred or double vision, difficulty with balance and coordination, urinary incontinence, cognitive impairment, and lethargy. Diagnosing hydrocephalus involves a thorough neurological examination and imaging studies. Doctors will look for characteristic signs and symptoms and assess reflexes, muscle strength, and other neurological functions. Imaging techniques like a CT scan or MRI of the brain are crucial for visualizing the ventricles and identifying any blockages or abnormalities in CSF flow. In some cases, a lumbar puncture or spinal tap might be performed to measure CSF pressure and analyze the fluid. Hydrocephalus is often classified as either communicating or non-communicating. Communicating hydrocephalus means that the flow of CSF is blocked after it exits the ventricles. The fluid can still flow between the ventricles, but can't get absorbed properly. Non-communicating hydrocephalus, also called obstructive hydrocephalus, means there's a blockage within the ventricular system itself, preventing CSF from flowing freely between the ventricles. The primary goal of treatment is to relieve the pressure on the brain. The most common treatment is surgical insertion of a shunt. A shunt is a flexible tube that diverts CSF from the brain to another part of the body, usually the abdominal cavity, where it can be absorbed. Another surgical option is endoscopic third ventriculostomy or ETV. In this procedure, a small hole is created in the floor of the third ventricle, allowing CSF to bypass the obstruction and flow normally. In some cases, the underlying cause of the hydrocephalus, such as a tumor, may be treated directly. Unfortunately, hydrocephalus is not generally preventable, particularly in cases of congenital malformations. However, minimizing the risk of acquired hydrocephalus involves taking steps to prevent head injuries, promptly treating brain infections like meningitis, and managing risk factors for stroke, which can sometimes lead to hydrocephalus. Prenatal care may reduce the risk of congenital hydrocephalus. The prognosis for hydrocephalus varies widely depending on the cause, severity, and timing of diagnosis and treatment. Early diagnosis and intervention can significantly improve outcomes. Some individuals with hydrocephalus can lead relatively normal lives with appropriate treatment and management. Others may experience long-term neurological complications and require ongoing support. Research is continuously evolving to better understand hydrocephalus and develop more effective treatments. Newer shunt technologies are being developed to reduce complications, and gene therapy is being explored as a potential treatment for some forms of the condition. Thank you for joining us today as we explored hydrocephalus. Understanding this condition is the first step toward better care and outcomes for those affected.